Finally tonight, this coming Friday marks the 50th anniversary of the assassination of President Kennedy. With each passing year, there are fewer eyewitnesses able to share their stories. Some never have in front of a national television audience, including a Texas doctor named Red Duke.
It appears as though something has happened in the motorcade route.
President John F. Kennedy was shot at 12:30 p.m. Central Standard Time.
He was wounded in an automobile driving from Dallas Airport into downtown Dallas, along with Governor Connolly.
35-year-old fourth-year surgery resident Red Duke was on break at Parkland Memorial Hospital.
I heard the chairman of surgery, Page Stat. Well, that was unheralded. I went over to answer the phone. Another fellow got there first. I said, "What's the matter?" And he said, "Well, the president's been shot." And that's so out of character. I mean, you don't even imagine that sort of thing happening. And I actually, for a moment, thought, well, I'm going to get to meet a president. I've never met one of those.
When Duke arrived outside the emergency room, it didn't take long to appreciate the gravity of the situation.
I saw Mrs. Kennedy with some badly stained clothing, and I thought, ooh, this is not good.
You knew as soon as you saw the president.
When you see that kind of wound, you know what it is. But they said, well, the guy across the hall needs some help. I thought, well, I've got as good a chance to help somebody out there as I do here. So I walked over there, and I didn't know who it was. It's the man in a suit.
The man in the suit was Texas Governor John Connolly, who also had been shot and who was not being tended to. Red Duke got to work.
Put a chest tube in him and then went through the other maneuvers you have to do to get somebody ready to go to the operating room.
If Governor Connolly had not been treated, he would have died.
He couldn't do that for very long.
When you think back on that day, does part of it still seem like a dream?
Yeah, it's the surreal thing. It actually is kind of an out-of-body thing. That doesn't happen.
Presidential historian and Rice University professor Douglas Brinkley.
Red Duke is a trauma doctor. Well, he was there when our nation went into trauma.
There's only one word to describe the picture here, and that's grief.
And when you think about what the doctors dealt with that day at Parkland, they did a great job because Red Duke recognized Kennedy's dead. I got to go work on John Connolly. And of course, Connolly not only survived, but went on to have decades active in American politics.
Governor Connolly and Red Duke also became great friends and lifelong hunting partners. Connolly passed in 1993, but Duke still hunts today. He also dabbles in painting, but there's one image he can't bring himself to create on canvas: the roses carried by Jackie Kennedy that he found abandoned.
That's a hard painting. As I walked out of the room, I pulled my gloves off and threw them to a kick basin, and those roses were upside down in that kick basin, and my gloves fell over it.
You think about those roses?
Mm-hmm. Did this morning.
When he's not painting, Duke teaches medical students and still treats patients today. At 85, he says he has no plans to retire.
Today is the 53rd anniversary of the assassination of President John F. Kennedy in downtown Dallas. The president was then rushed to Parkland Hospital that day. Less than an hour before, he'd arrived at Dallas Love Field with First Lady Jackie Kennedy and then took the ride through downtown Dallas in the open limo. Former Arlington Mayor Robert Cluck was a medical student at the Parkland Hospital ER that day, and he's speaking about that day for the first time. Fox 4's James Rose spoke with Mr. Cluck, and James, he doesn't tell it much, obviously, because he became emotional at times with you.
Absolutely. He has shared this story with a few close personal friends over the years, but he's never publicly spoken about what he calls the darkest day of his life. Cluck says he went from his highest high to his lowest low, and even though 53 years has passed, he says each and every year he still feels the pain lingering from that day.
It was like magic. It's the president, my president, by the way.
Former Arlington Mayor Bob Cluck remembers it vividly, traveling to Love Field to see the president and First Lady in person. He remembers shaking the president's hand so close he could smell his cologne.
It was really a magical moment for me.
It wasn't long before that magic turned into madness.
Now the presidential party will leave Fort Worth, go to Dallas, where this afternoon he will address a crowd at the Trade Mart.
And I heard this commotion in the radio that something had happened to the motorcade. Wasn't sure what it was, but it wasn't good.
Cluck, then a third-year medical student, was assigned to the ER at Parkland Hospital.
I walked in the emergency room, and there's all this activity. And then all of a sudden the door burst open, and he was right behind that. Clearly, fatally injured.
Cluck says he watched helplessly in a trauma room.
Stood there breathlessly, not believing what I was seeing. They quickly started IVs, started getting blood pressure readings, and then they started taking his brace off.
Cluck says the president was wearing a very tightly lashed back brace.
But once they got it off, I could see his injuries much better. Not that I wanted to. I wish I hadn't.
He says doctors did everything they could for the mortally wounded president.
So finally we got so many people in the room and doctors. I walked out of the room and she was sitting right there.
A half-century later, Cluck finds it impossible to hide the pain of recalling what he told Mrs. Kennedy.
She said, how is he? I said, well, they're doing everything they can for him. And the most important thing, the doctors are going to come out here, the ones who are taking care of him, are going to come out here as a group and talk to you. She was crying, not heavily, and she said, thank you for the information. That was it. I turned and left.
You've never publicly spoken about this.
No, I haven't.
It's that difficult.
Yeah, it is. You saw it.
As he walked outside the ER, he could see the president's car.
The setup were the roses on the concrete, the car with the top down, and just the massive scale of what was going on in that room, what was going on around her. It wasn't pandemonium, but it was earth-shaking. I just felt totally bad that he came to Dallas, my city at the time, and somebody shot him and killed him. And I still have trouble with that concept.
Now, Cluck says he realizes why tens of thousands of people come out here to Dealey Plaza each and every year, but for him, this anniversary, a week before the anniversary, he says he starts feeling sadness and a time of reflection. He says he talked to me essentially to get it off his chest and put it onto the historical record.
This is a taped interview between Jeremy Akers and Patricia Orr with Miss Sylvia Tuohy. I did it again.
Yeah, back it up.
As you were, Sharon Tuohy. And this interview is taking place on the 1st of December, 1976, at approximately 3:15 p.m. Okay, Ms. Tuohy, would you basically repeat your story, which you related to Ms. Orr and myself, with respect to your activities at Parkland Memorial Hospital in Dallas on November the 22nd, 1963?
Yes, I was a student nurse at the time, and during lunch on the 22nd of November, I noticed there were 2 or 3 people who came into the cafeteria area looking for emergency room and operating room staff. Working in the emergency room part-time as a student nurse, my interest was piqued as to know what problem had occurred. No one made any comments about any such incidents. Not knowing what was going on, I finished lunch, went to the library, and was waiting for my 1 o'clock class to start. There was one outside line telephone in the library. There was a doctor on the telephone, a reporter from one of the newspapers known to us because he was at Parkland at various times for stories, came in, asked the doctor to let him use the phone, was told to wait, asked the doctor again to use the phone and was told to wait. And with that, he proceeded to hit the doctor in the chin, knocked him down, proceeded to make a telephone call, and his story to the person at the other end of the line was that someone in the president's motorcade had been injured and was being brought to Parkland Hospital. Myself and another student nurse, Donna Schloss, overheard the conversation, and both of us working in the emergency room at various times went down to the emergency room area to see if we could be of assistance. When I arrived in the emergency room, I asked if there was anything that I could do, was told just to help clear the corridors, help with any patients who needed assistance. I remember there were two people who had fresh cast for broken bones put on that were in the center corridor area, and I helped these people out into the waiting room area. Coming back into the center core area, there was a stretcher that came in from the hallway with a body on it. It was being rushed toward one of the trauma rooms. I went with the stretcher into trauma room 1. I recall that the patient had a bullet wound in the front, above the right collarbone, slightly to the right of the center neck. We started to get his shirt off. The back of his head, above the base of the skull, contained a large cavity, which appeared to be an ugly wound, a lot of tissue showing, a lot of blood in the area on the head. The wound appeared big enough for both fists to go into. Both doubled up fists could have fit into the area. I remember after getting his shirt off, the IV bottles were prepared, tracheotomy tray was prepared, the blood was drawn for type and cross-match, and vital signs were taken. I remember at the time the patient had a pulse and was breathing. I don't remember blood pressure count, although it was being taken. I remember there was noise in the room. It was difficult. The person taking it was saying it was difficult to hear. At this time, the tracheotomy incision was made after some comment that there would have to be a new incision made, that the hole that was present, which appeared to be a bullet hole, was not in the right location to be used for the tracheotomy. I remember Dr. Jim Carrico making an incision and getting ready to put in the trach tube itself when Dr. Perry opened the door into trauma room 1 with his hip. His hands were held up as though he had just scrubbed for surgery or was working on another patient in some way. He said to the people in the room at the time, "You do know that's President Kennedy you're working on, don't you?" As I remember it, everyone stopped what they were doing for just a few seconds, probably 1 to 2 seconds, perhaps 3. Dr. Perry walked up to the patient and put the tracheotomy tube in. At that point, we were all aware of who the patient was. At this time, I took a tube of blood over to the blood bank for type and cross-match. I gave it to a lab technician who said to me, as he broke it into the trash can, it's not a labeled tube. It doesn't matter whose blood it is. I rushed back to the trauma room 1, got another tube of blood that had been drawn from the president, put his name on it, and ran back to the blood bank. And the blood was turned in for type and cross. With the time sequence in being gone from the room was probably not more than 90 seconds to 120 seconds. After returning the second time, there did not seem to be anything else that I could do that would help to promote the welfare of the patient other than being in the way. Both times when I left the room, I saw Mrs. Kennedy standing across the hall with her back to trauma room 2, facing trauma room 1. I do not recall seeing in the immediate area of trauma room 1 any policemen or Secret Service people. I went into the general area of emergency room to see if there were other patients who needed assistance. I stopped and spoke with one lady. As I recall, she was a miscarriage case, but I could be mistaken about that. She was in need of no assistance at all. I made sure that the curtain was pulled so that she had privacy and couldn't see what was going on in the hallways. At this point, I went to an elevator, going back up to the first floor. Donna Schloss also reappeared shortly before I went through the door toward the elevator, and we both were going to go upstairs. Beside the elevator, against the wall, the side of the wall that the elevator was on. There was a stretcher containing dirty sheets, which were bloody, and there was a bullet that appeared to be a dirty brass in brassy yellow in color, short as I remember it, on the stretcher, on the metal stretcher next to the mattress. Donna and I, as I remember, Donna and I both saw this. We both made a comment at the time that it did not belong there. Neither one of us touched it. Neither one of us changed the sheets or cleaned up the stretcher. We went upstairs and proceeded to a classroom where the emergency room entrance could be seen from the windows. I would estimate the time that I returned up to the first floor into this classroom would have been between 5 minutes to 1 and 10 minutes after 1 is the latest. We watched the procedure. We watched out the window to the emergency room entrance area where the hearse had been driven up. We did see the casket. I did see the casket put into the car. Mrs. Kennedy came out, opened the car door, got in, placed her hand on the coffin, then appeared to look around to see who the people were in that immediate area. She got back out of the car, walked over to a policeman, shook his hand, and appeared to touch his cheek with her cheek, or perhaps a small kiss, and in some way seemed to give, it looked as though she were saying thank you. She walked back over to the car, opened the door, got in, put her hand on the coffin, and the car drove off.
Okay, let me ask you a question or two about what we've just gone through. All right, you initially reported to the emergency room and waited for how long before President Kennedy arrived?
I think it was not more than 5 minutes from the time I arrived there till the time he arrived.
Now, when his stretcher was brought into the emergency room, you've related that you accompanied the stretcher into trauma room 1. Is that correct?
That's right.
Do you recall the names of any other persons who accompanied the stretcher into the trauma room?
Only Dr. Carrico. I just don't remember the names of the other people. Doris Nelson, the supervisor, may have been with it at that moment. I know she was in the room later. Whether or not she accompanied the stretcher, I don't know.
Now, who is Doris Nelson?
The nursing supervisor in the emergency room at Parkland Hospital at that time.
What would have been her function in the emergency room?
Overall supervision to see that all patients were cared for, that the staff was on duty, that equipment was in working order, this type of function.
Would she have been the person who assigned this particular stretcher case to trauma room 1?
No, that wasn't actually done. There were, if trauma room 1 was open, it was used first. Trauma room 2 was used second, only because of habit, probably more than anything else. Both trauma rooms were set up to handle trauma cases. They were both set up equally. It didn't make any difference. The ambulance drivers, the orderlies, the nurses, they all knew those 2 rooms were there. So the room specifically would not have been assigned ahead of time, nor would the personnel who went with the stretcher have been assigned. When a stretcher came in containing a trauma victim of some type, a cardiac case that might have been in that area, it automatically, a group of people formed and went with that stretcher and that patient.
I see. Do you recall how large a group would have accompanied the stretcher? How many persons were in the group?
I don't specifically remember a number. Ordinarily, there would have been 4 or 5, possibly 6.
And you've related that you observed a wound in the neck of the person who was on the stretcher. At what point did you observe this wound? At what point of time?
Well, I would think almost, as I recall, it would have been almost immediately after we got into trauma room 1, because we were looking for the source of the injury first. So one of the first things we would have done would have been expose the body and seen the wound.
All right,
whether or not I saw it before we actually started taking his shirt off or not, I don't remember.
All right, how would you describe this wound that was in the neck? First of all, how large was the wound?
I recall it being between the size of a nickel and a dime, small, probably closer to the size of a dime. There was some blood around it, perhaps 5 cc's total. I don't remember it as being a ragged or torn wound. As I recall, it was rather it was small, it was smooth. There was blood there, but there was not a lot of excess tissue around it.
Where would you describe the location of the wound as being in relation to the location of the trachea or the center of the neck?
Approximately 2 inches to the right, in almost a straight line, perhaps down half an inch, but not more than that.
All right, when you say 2 inches to the right, are you...
From the area of the trachea, where the tracheotomy would have been later.
Well, are you referencing that when you say to the right? Would that be as you were looking at the patient, or...
No, to my right on my body. So as I looked at him in this way, it would have been toward his right arm.
As you looked at him, it would have been toward his right arm. So
Toward
as you looked at him,
his
it would have
right
been to your left and to
Right.
his right.
Yeah.
Okay, and you specifically recall conversation to the point that this wound was not located in an appropriate area that it could be used for the tracheotomy itself.
That's right. I don't remember exactly who said what, but there was general, about that matter, but there was general conversation around the table that there would have to be another incision made for the tracheotomy tube to be placed into the trachea.
Do you recall who made that incision?
Dr. Jim Carrico made the incision. He was the physician who was doing the entire tracheotomy procedure, as I recall. Up until the time that Dr. Perry walked in and put the tracheotomy tube in, after saying that this was President Kennedy we were working on.
Right, you related that to us. Now, do you recall at what point you would have observed the second wound, which you told us about, the wound which was in the rear of the head?
Well, again, almost immediately after the patient was in the trauma room, because we were looking for the source of the injury in order to know what types of medicines and IV fluids and such to give. So I would think within 30 seconds of his being in there.
Would you again describe that wound that you observed in the rear of the patient's head?
It was large. It was ragged. There was what appeared to be brain tissue present. There was certainly tissue of some type there. There was quite a bit of blood. Had very jagged edges. It was large enough, as I remember, easily for 2 doubled fists to fit in with some room left around it. The patient was still breathing. He still had a pulse while we were looking at this. It was a very messy wound, as I recall.
And would you describe the wound as being located in the direct center of the rear of the skull, as, for instance, centered over the neck stem?
Not directly in the center. More toward the right, but certainly centrally located. It was not the entire back of the head. It would be more to his right, as I recall it, but certainly included the center area of the back of the head, but toward the right, his right ear.
Could you tell us how far from the right ear that the right portion of the wound cavity extended?
As I remember it, it would not have been more than, there would have been 1.5 inches approximately of space between the back of his ear and the right outer area of the wound.
Was any part of the top of the head damaged?
Not that I recall at all. I don't even remember his face being disfigured. Certainly there was blood there. There was, it was a messy looking thing to look at, but the top of his head, I don't recall being affected at all.
And did you observe any other wounds, say, in the back of the patient's body or in the neck?
No.
The back of the neck?
Only the 2 wounds that I've described did I actually see, and I didn't observe any others.
You saw absolutely no other wounds which you would have construed to be either entrance or exit wounds?
I did not.
Only the 2 wounds that you have described to us.
Right.
Did you examine the body in such a way that it it would have been likely for you to observe any other wounds had they been present in the upper portion of the patient's body?
I certainly probably would have seen any that were in the chest area. Not particularly would I have seen any on his back. I remember helping move him, helping get his shirt off, getting him straight on the stretcher, this type of movement. But I don't recall seeing his back or being in a position where I particularly would have.
Had there been any other wounds in either the neck or the head area?
I would have seen those.
Okay. Now, how long do you estimate the period of time between the entrance of the patient, who was subsequently identified to you as being President John F. Kennedy, how long from that time that he entered the emergency room was it until you left the emergency room and went to the elevator where you observed the stretcher that you previously described to us?
Well, I was in the emergency room approximately 5 minutes before he came in. I would estimate 20 to 25 minutes in trauma room 1, perhaps closer to 20. It was probably not more than another 3.5 to 4 minutes before I went, after leaving trauma room 1, when I proceeded to the elevator and went up to the first floor.
All right, you were in the emergency room 4 to 5 minutes
before
the president arrived.
Right.
Then you were there another 20 minutes?
In trauma room 1, 20 to 25 minutes.
And then you would say, and then another 3.5 minutes before you would have arrived at the elevator.
Right. 3.5 to 5 minutes. I just don't think it was longer.
So we're talking 25 to 30 minutes from President Kennedy's arrival at the emergency room to the time that you observed the stretcher on which the bullet was located.
Right, right. But the location of the stretcher in itself in no way can be, it could not be certain that it would have come from his area. It could have come from other areas of the emergency room. It could have had absolutely no bearing upon the case at all. It could have, but it as well could not have.
Could you describe again exactly what was on the stretcher, what the stretcher looked like?
It was a regular emergency room stretcher used in that hospital. It had a black covered plastic, leather-like covered mattress on top of the metal base. There were sheets that were bloody, thrown on the top in disarray. There was a bottom sheet that had obviously covered the mattress that was still partly around the mattress. The sheets were thrown up in the middle. The ones that were loose could have possibly been one sheet. It could have been two. They were bunched up in the middle area of the stretcher, and the bullet was lying on the metal shelf or base next to the mattress on the long side of the mattress.
Was there anything else on the stretcher, like surgical instruments, sterile packs?
Not anything that I saw, not anything else that I noticed.
Was there anything strange or abnormal about that stretcher, those bloody sheets, being in that particular location at that time?
No, yeah, they could have come from any place. It was not an unusual sight to see something like that there in that area.
What other places could the stretcher have come from?
It could have come from the major medicine or the OB section of the emergency room. It could have possibly come from pediatrics if they had had an injury of that type. Any area that needed a place to put a stretcher to get it out of the way of what they were doing at the time.
And would you say that it possibly could have even come from trauma room 2?
It could possibly have, yes.
I see. Now, could you also explain to me why you never reported seeing this bullet on this stretcher to anyone previous to this time?
I really can give no other reason, any more so than I didn't report anything of my involvement there. I went back down to the emergency room to work at 3 o'clock, and by this time I had thought about it and went back to see if it was still there, and it was gone. There were policemen around the hospital, there were Texas Rangers, there was still shock and confusion over what had happened. Business was going on as usual in the emergency room. I didn't report it to anybody. dwell on it as something to go and tell somebody immediately. And I realized that it might have no importance at all. It could just be coincidence that it was there.
At what time would you have gone back down and seen that the stretcher had been removed?
At 3 o'clock.
Did you, at any of these 2 times that you were down in the elevator lobby area, observe any other person in that area other than you or Donna Schloss?
No, I did not. I saw no other person in that immediate area at any time that I was there by the elevator.
Was there somebody manning the elevator at that time, or was the...
No, it was a self-service elevator, and you just pushed the button and it came to the floor.
Were there any stretchers in that elevator?
Not that I remember.
Ms. Tuohy, have you ever been contacted by or interviewed by anyone from any agency whatsoever concerning your activities and observations at Parkland Hospital on this day?
No, I've not been contacted by anybody from any agency or any investigation team.
Have you ever voluntarily, on your own, called any agency or body in order to volunteer this information?
Well, I called your assassination committee to ask to speak to someone, but that's the first time and the only time that I've called and made an effort to speak to anyone about this. I can't remember the date.
I'm not sure. Okay. Could you please relate that little incident in Cambodia that occurred in 1973?
Yes, during a tour with Department of State as a Foreign Service nurse, I was in Cambodia in Phnom Penh on temporary duty, relieving a nurse who was permanently stationed there. During this time, Vice President Agnew made a visit to Phnom Penh. And I was told that as the medical person at post that I was to be in the room underneath where he was speaking at all times, if that was possible. So I went to the second floor, was assigned to stay in a room until he had left that room on the third floor, which was just above. I went out into the hallway to get a drink of water from a fountain that was there. And down on a landing in the stairwell was a man who I assume was Secret Service agent. He had a gun with him that looked like a sawed-off machine gun. That's what it looked like. And I said something to him like good morning or hello on this line, and he asked who I was, and I told him my name was Sharon Tuohy. And he said, oh yes, you're the nurse who was in Parkland Hospital when Kennedy was, during the Kennedy assassination, or when Kennedy was shot or something. And I said, yes, I am. I was there when that happened. And I said nothing else to him other than, excuse me, I have some work to do.
Well, what was your reaction to this statement by the Secret Service agent?
Well, I felt very surprised that he knew about that, and it crossed my mind to wonder who had what information on computers now that might possibly have given him that information. It didn't seem normal to have the actual staff of an embassy investigated before a vice presidential visit or other VIP visit. It would seem unusual.
Okay. I think that pretty much covers the questions I have. Tricia, anything?
Just to get the timing again, you were still there after Perry left. Is that right?
I remember Dr. Perry leaving Trauma Room 1. He well might have come back after I left, but I don't remember him staying in that room the entire time after he put that tracheotomy tube in.
How much longer were you in the room after Dr. Perry left?
Oh, perhaps, well, let's see, put the trach tube in, I went to the lab, came back. I don't even remember for sure if he was there when I came back from the lab. So, I don't remember him leaving at a specific time, I just don't remember him being there the entire time until I left after taking the blood, which was several minutes, I would think, up to 6 to 8 minutes after I came back, if not even 10.
But you were not there when the president was officially pronounced dead?
No, I was not in the room when he was pronounced dead.
Okay, let me get just some quick personal data. We already have it on paper, but I'll get it from you on tape. What's your full name?
Sharon Lee Tuohy.
You were born when?
16th of March, 1943.
Born where?
Fort Worth, Lubbock, Texas.
Went to college where?
At Texas Women's University in Denton, Texas.
Graduated when?
June of 1965.
Then where did you work?
I joined the Army in June of 1966. I was in Vietnam at 93rd Field Hospital from September of 66 until late September of 67. I then worked at Fort Belvoir as an Army nurse until June when I was discharged from the Army. I then went to D.C. General and worked in the emergency room.
When did you join D.C. General?
In October of 1968. And I quit working at D.C. General in the emergency room in May of 71. Joined the Department of State as a Foreign Service nurse in November of 71. Went to Bangkok on assignment in December for 2 years, and during those 2 years spent approximately 6 months at various intervals in Cambodia. I then was on assignment in La Paz, Bolivia from May of 74 until October of 76. And at this time am on assignment to Peking, China, departing the 5th of December.
How can you be contacted in Peking?
Through the liaison office, through the State Department channels, but with the liaison office in Peking.
Yes. Mr. Thank you very much. Do you have anything else to add that you would like to? Well, this recording has been made pursuant to your permission. Is that right, Mr. Tuohy?
Yes, I'm fully aware that it's being taped and it is done with my permission.
Thank you.
This is Howard Gilbert. I'm in the apartment of Miss Audrey D. R-E-Y-N Bell at 4317 Hartford, apartment 103 in Dallas. Today is March 12th, 1977, a Saturday. It is approximately 6:35 in the evening. Also present is Mr. Jack Moriarty of the task force, and Miss Bell's sister is also present in the room. I'm now going to check and see that it is recording properly. Now, Miss Bell, you can observe that we are tape recording a statement from you, can you not?
Yes.
And this is done with your permission, is that
Yes.
correct? Now, prior to our taping this statement, we chatted for some 15 to 20 minutes, is that correct?
Yes.
All right. Now, Miss Bell, I want to direct your attention to November 22nd of 1963 and ask you where you were employed at that time.
Parkland Memorial Hospital, Dallas.
All right. And in what capacity were you employed?
Supervisor of the operating rooms and recovery rooms.
All right. Now, do you recall the incident where Governor Conley was operated on that day?
Yes.
And do you recall who the orthopedic surgeon was?
Yes, Dr. Charles Gregory.
And who was the thoracic surgeon?
Dr. Robert Shaw.
Now, you have informed me that certain foreign bodies were taken from the body of Governor Conley, is that correct?
Yes.
And what is the procedure that was used at the hospital for the removal and recovery of foreign objects?
On that, the procedure is that the objects are removed by the surgeon and either placed in a container or given to the scrub nurse to place in a container on the scrub nurse's table. Then they're taken...
Well, just a minute. Would you describe the type of container that they would be placed in?
A small glass container, about a 1 ounce medicine glass.
Similar to a size and shape to a shot glass?
That's right.
All right. After the objects are placed into the container by either the doctor or the scrub nurse, what then occurs?
On that particular case, they were given to me, and I took them into my office and prepared one of our foreign body envelopes.
Foreign body envelopes? What is
Yes.
that? Would you explain that?
We had a foreign body envelope in which we could record the name of the patient, the hospital identification number, the foreign body, with a description, whether there were any markings on it, who the surgeon was, and we signed it off ourselves.
Would you describe on the envelope the number of objects placed within the envelope?
Yes.
And with respect to the objects taken from Governor Conley's body, who prepared that particular envelope?
I did.
That was done in your own hand?
Yes.
And did you place the objects that you took from the operating room in the envelope yourself?
Yes.
Did you seal it yourself?
Yes.
And did you place the description of those objects on the envelope?
Yes.
Now, to the best of your present recollection, how many individual foreign objects were placed into that envelope taken from Governor Conley's body?
4 or 5. I am not sure at this particular time.
Do you have a recollection as to whether or not those objects were metallic objects?
Yes. They were metallic, grayish in color, as well as I recall.
All right. And after you placed them into the foreign body envelope and sealed that envelope, what did you do with it?
I delivered them to the FBI, and he signed a form. This was a deviation from our procedure. He signed, I took an inter-office memorandum and wrote on there about my delivering these to the FBI. I believe Mr. Sorrells, and he signed it.
Now, you believe it was Mr. Sorrells?
I believe so. I recall this name. I
you
recall this name.
You recall the name, but you're not positive
sure.
at this point
No.
that it was Sorrells.
No.
But it was someone from the FBI who showed you
The FBI or the
identification.
Secret Service that I gave it to. And
Did
I
they
think
show
it
you?
was the FBI.
Did they show you identification?
They probably did. I saw so much ID that day that because we had so many of these people around in surgery.
When the envelope was turned over, it wasn't a sealed condition, is that correct?
It was sealed.
And if the envelope was to be produced today and the envelope described the number of metallic objects, that would have been the number that you yourself ascertained went into the envelope at the time that you sealed it?
Yes.
And you're sure of that?
Well, that's what I put in it. I don't know what would have happened to it since then.
Fine. Now, your best recollection you indicated to me was how many specific types of foreign objects or
4
number?
or 5.
All right. Now, I have asked you to, on a piece of paper with a pencil, to draw for me, if you would, the smallest in size, on a one surface size, of the foreign objects. Would you do that again, please?
It's difficult.
All right. Now, would you please put a large circle around that? And would you write your name next to that, please? And would you place today's date, which is March 12th? Now, you have written that in pencil, have you not?
That's right.
Now, will you please circle the entire thing that you have done with a blue felt tip pen? And would you write on there Exhibit A? Now, Mr. Moriarty, I'm going to ask that you also sign that sheet of paper at this point. Now, if I understand you correctly, you're saying that of the objects, the foreign bodies that you placed into the envelope, the small pencil diagram that you have just drawn indicates the smallest, in your recollection, of the foreign objects that would have gone in.
Yes.
Would you fill in the blue ink the little circle describing the object that you have drawn in pencil? In other words, just kind of color it in blue so that we have it as a permanent record. All right. Thank you. Now, we may have said this, we indicated that we were taking this statement at your residence, which was 4317 Hartford. Your home phone is 526-5369?
Yes.
And your present office address is, telephone number is 637-3820, extension 317?
Yes.
And you were presently employed by who?
Children's Medical Center.
And you are the what?
Supervisor of the operating suite.
All right. Now, is there anything that you would like to add with respect to what we have discussed here to make your statement more complete or to explain anything that we have discussed while the tape recorder has been on?
Just that it has been many years, and this is all just trying to recollect what happened on that date. I cannot swear, I cannot be absolutely certain of the number of small fragments.
Your best recollection
But my
is?
recollection is 4 to 5.
All right. Mr. Moriarty, do you have something to add?
No, I haven't.
Then it is now 6:45 p.m., and this is the termination of the tape.
The findings on the Lee Harvey Oswald revealed that he died as a result of hemorrhage from the gunshot wound. He was otherwise a healthy male, a physically healthy male.
Doctor, by that you mean he didn't have any kind of brain tumors or anything that would cause him to be a mentally deranged person?
No, their brain was normal in configuration, and there was no evidence of any brain tumor or injury to the brain.
Today, December the 11th, 1985, I have the pleasure of being in the home of Dr. J. Lawrence Poole in West Cornwall, Connecticut. Dr. Poole, as many of you know, is the Professor Emeritus and long-term Director of the Neurological Surgical Service at Columbia Presbyterian and the Neurological Institute of New York. I'm particularly privileged to interview Dr. Poole today for the archives of the AANS, as he was my chief when I was in training at the Neurological Institute. Dr. Poole is one of those rare individuals. Not only is he multi-talented, but he's also a native New Yorker. He was educated at St. Paul's School, Harvard College, and Columbia Presbyterian.
So I'm trained as a physician. I graduated from medical school in 1964 and trained first as an internist and then as a cardiologist, and subsequently became a clinical lipidologist, a cholesterol specialist, and spent most of my career as a preventive cardiologist, working with patients who wanted to learn about nutrition and how to prevent heart disease, and also how to use natural medicine to treat their heart disease.